is treated by many people. So many a times they come to us, orthopedic surgeon who treats diabetic foot late. So what mistakes usually happen before they come to us? First thing is patient side mistakes. Patient forgets that he should never walk barefoot. First thing. Second thing, he forgets that he has to examine his foot every day. Third thing, whenever there is a cold, he uses warm padding and all that, so that it lands up in burns. And another thing is, he never cares about his deformities. So what are the problems missed by the treating doctor? So these are the mistakes which a treating doctor makes while handling a diabetic foot. So patient comes to whenever he comes to a doctor, many doctors doesn't know these deformities. So what they do, swan neck deformity, hammer toe, and hallux valgus, crossover toes, all these are the problems which are the baby steps to a major complication like amputation. So the patient might land in amputation. First thing what happens is a callus is formed. So what we see only the tip of the iceberg. Instead of treating the deformity, we start treating callosities and corns. So we land up in next problem, that is an ulcer, non-healing ulcer in a diabetic foot. Slowly the infection starts spreading from here. They do not have much healing capacity. Usually their regenerative capacity is very low. So why this is low, we'll come to that in the next step. So this leads to spread of infection and lands in amputation. Next step is amputation. So third thing what happens, because many patients who come to me, they do not have vascular workup. So most of them have vascular problems. They do not have blood supply. So blood supply, when you don't have, that wound never heals. So what to do? You have to increase the blood supply. So there are only two options. One is vascular surgeon has to do a stenting work, or an orthopedic F.I.J.R surgeon has to come in to save the limb. So who is better? That only time will tell, because an orthopedic F.I.J.R surgeon can do what a vascular surgeon cannot do. He can only handle, a vascular surgeon can only handle a macrovascular pathology where he can revascularize a major vessel, but he cannot handle a microvascular circulation, and microvascular circulation will improve only after doing an F.I.J.R surgery, cortical distraction. While doing distraction, blood supply increases by 300% and we can avoid amputation, and also recurrence rate is also less. It is better to handle the patient early days, because most of the times by the time they come to me, they land up with one toe, two toe, or no toes. So it is better to send them early before the ulcer is formed. So all these things. So when there is an ulcer, there are some tendon problems. So we have to do some tendon transfers, hallux valgus surgeries, all this. So thank you.